Hey you guys, it's Dr. Emmer. We're back in Midtown Manhattan, and we are doing the second part of our laser rejuvenation, facial rejuvenation treatment with Clear and Brilliant. My favorite treatment for maintenance of your skin, improvement of melasma, shrinking of pores, and just overall anti-aging is Clear and Brilliant. This you can see as you zoom in real close. Take a look. You can't even see beams. They are hidden because there's intra-optical scanning on this device, so it only fires milliseconds so fast that you can't see it as the laser rolls across the skin. And the great thing about this is the downtime is minimal. She's only going to feel sandpaper-like texture, have a little bit of redness and swelling for a few days, and that's it, and her skin's just going to look really nice. Over time, pores will shrink, melasma will reduce, you can prevent skin cancers with these types of treatments, etc. What I always tell people, we should combine this with other lasers that tighten the skin, like our Fractora treatment, which is called our Tighten Bright, or our Aerolase treatment that we just did for melasma and acne, hormonal acne, because my patient gets some outbreaks.
Is it hot?
What?
Is it hot?
How does it feel?
It's like a little pinching.
Yeah, a lot
Tiny
of people
bit.
say a little pinch is like nothing big. My women who do hot yoga have had kids, they're fine. I've never had an issue with anyone. And my men are always the babies. So in general, men, if you're getting this treatment, look at my women. You should be bearing through it because they go through everything with you guys. And what's great about this treatment is you just get a long-term improvement. You know, we can go along the jawline to help get some improvement in color and texture. But in general, this is really more of a color pore reduction technology than it is a skin tightening. Acne scars can be treated and deeper wrinkles can be treated with the original handpiece, which is a diode laser handpiece called the original. It's a white color. This is a blue color called Permea. Permea was developed to help push products into the skin like PRP that you could put on afterwards to make the skin glow, vitamin C, hydroquinone for lightening of the skin, kojic acid, azelaic acid, etc., or glycolic.
Is it expensive?
No, everybody, it ranges. I would say you could probably, at a normal doctor's office that's experienced, somewhere $475 to $600, depending on how many areas you treat and what you do with it in general. So it just depends. You could do peels in between. We like to do this with Cosmelan or Enlighten Peel to help get more improvement with melasma, because remember, when you apply a topical product on immediately afterwards, what happens, you guys? Penetrates more deeply, because this is the Permea. So you can get more improvement in your Cosmelan peel by doing the Clear and Brilliant with, and we call that the Cosmo Peel. Alright.
People are wondering about the marks in your face.
That's another treatment. You don't have to worry about that. We're not talking about that today. We're talking about the Clear and Brilliant right now. Everything else were other treatments that we performed.
Would you recommend this for 19 to 20-year-olds?
Yeah, I mean, this is a great laser facial. This is great for teenage acne. This is great for those that just want to rejuvenate the skin. You can do this with peels. You can do this in between your peels. So for younger people, and they're 19, 20, 21, that don't want to do aggressive lasers like Fraxel or CO2, but they want to do things to maintain, you can do this and be very happy. Shrink the pores, look great. I have a lot of Disney stars that go to see me that do this treatment to make themselves look really great on camera. If you're an actor or actress, you wear a lot of makeup artists, etc., and you get acne, Clear and Brilliant's for you.
Okay. Can this work for red acne marks?
For acne, no, it doesn't work for the redness. It works to decrease the acne and the scarring, but the redness needs to be treated with a vascular laser, like pulse dye laser, yellow laser, IPL, depending on your skin type, V-beam, XLV, Venus Versa.
How many years of treatment would you need a year?
How many who?
How many years of treatment would you need?
How many years? I've been doing it every year. I've been doing it every 2 months, 4 to 6 weeks for 3 years, 4 years. This is a long-term treatment. This is a forever treatment, guys. This is a maintenance treatment. So that's really Clear and Brilliant. Do you want to say anything else about it? Anyone? No? No?
I mean, it feels amazing. Hopefully, result will be amazing too.
Yeah, I
mean,
think you'll be happy. What are you anticipating? What are you looking for?
Well, I have adult acne. I have little scarring, so I wanna
Yeah, so you
see
wanna
improvement
improve
there.
textures.
Texture of my skin. Also, like you said, I have a melasma. It just started under my eyes. Hopefully, it's gonna
That will get a little better.
get
You
rid
can
of
see,
it.
now we usually will have people do a Cosmolon 2, which is a combination of azelaic acid, kojic acid, vitamin C, retinol, hydroquinone product a couple times a week to their face for the pigmentation. Glycolic creams in the morning, hydroquinone at night, these type of lasers. So overall, let's hope that, even in one treatment, she gets some improvement, but typically this is something you do in a series, but we're going, a good amount. So I think we're going to see something nice.
Good for melasma.
It is if you do enough treatments for it.
So when you want me to come back, like you coming back in 6
Yeah,
to 8
do it
weeks?
then. Yeah, do it when you're
6
that. And then in the
weeks, okay.
meantime, we'll send you the skincare to do lightening at home and microrolling. That'll be
Okay.
perfect. I think that would be great.
But it's not gonna dry my skin.
No, well, you will get a little dry. Yes, you
Okay.
will. But it will get rid of the pigment, and then we rehydrate it. So
What about I like to be on the sun. I'm very active. I like to run and everything.
you just have to be as sun protected as you can, especially for the melasma. So sunscreen, a hat, that's the best you can do. I can't tell you not to be active. I want you to be active. You're going to live longer and be happier. Turn to the left. So I'm not going to tell you not to be active, but remember, melasma is hormone related and pigment related from sun and trauma and heat. So being outside in the sun can make the melasma worse.
What about sauna? Because I like to be in the sauna
Wait,
as well.
I would wait a little bit after the treatment, 72 hours.
As well, okay.
But yeah, that's not going to really stimulate your melasma that much after that time.
Okay.
So that's it for Clear and Brilliant. Those were great questions. I'm excited. We're here in New York and we're going to be back in the Big Apple in a few months. Bye, guys.